JBN, we keep you informed. Government rethinking field hospital at the National Arena, says Tufton. The government is thinking about building a new health facility on the grounds of one of the country's existing hospitals, instead of going ahead with its plan to set up a 72-bed field hospital at the National Arena in St. Andrew. Speaking at a press conference on Wednesday, Health and Wellness Minister Dr. Christopher Tufton said that although the contract has been signed for the field hospital, the matter has been discussed internally as to whether to continue with the plans. One of the things I have said to the team is that we should look at the existing contract or arrangements in terms of expenditure and look at an existing hospital and see if we could add a facility so that after COVID-19 you would still have the facility, as opposed to going to the National Arena and building out something that you may have to dismantle over time, he said. That is a consideration. You won't lose anything if you abandon one approach for another, or if you abandon it altogether, Tufton added. Tufton said the government does not want to build the field hospital and have it become another white elephant. First of all, we don't want it to be something that we spend money on and is not being used over time, he emphasized. At the same time, Tufton said there are concerns that as the country moves forward with the new normal way of living with the coronavirus COVID-19, and as the border reopens and movements become unrestricted, the risk associated with the virus will be greater. We are seeing evidence of that with the controlled re-entry, where we are seeing a number of persons testing positive, Tufton said, adding that 15 repatriated Jamaicans have tested positive for the virus so far. Therefore, he said the secondary health system has been expanded to include more wards to deal with the virus. The proposed field hospital will be used as an isolation facility and will respond to any surge in the cases. Riversdale mourns tragic end. Relatives and friends of 19-year-old security guard Ricardo Stevenson are devastated by his tragic death yesterday morning, May 21, at the Bogwalk Gorge in St. Catherine. Ricardo was employed to secure Pro Security Company and was based at the Separate factory. He graduated from Enid Bennett High School in Bogwalk in 2018. One of his former teachers, Gideon Johnson, said he was goal-oriented. Ricardo was a focused student who was goal-oriented and mannerable. He was quiet, witty at times, and was always respectful to everyone who came in contact with him, she said. The teacher, who remained close to Ricardo to the time of his death, added, "Everyone who knows Ricardo can attest that he was a pure soul. I pray that the good Lord will give his mother and brother the strength to cope with his loss." Meanwhile, Eric Stevenson, who is a brother of the deceased, said the family is hard hit. He said his parents and his sister are among family members who have been crying since they received the devastating news. Ricardo was a good brother, kind-hearted, loving, and caring, Eric added. He explained that Ricardo borrowed his cousin's car, left his Riversdale home, and was traveling towards Spanish Town to collect a certificate that qualifies him as a trained security guard. He was to do the collection at the headquarters of the security company to which he is employed. However, tragedy struck shortly before 8 o'clock. Deputy Superintendent of Police, DSP Dale Garrick, said the two vehicles involved in the crash were heading in different directions. She stated that, based on reports, the roadway was wet and slippery. DSP Garrick said Ricardo was driving a Suzuki Swift motor car around a corner when it seemingly skidded and slammed into an Isuzu box truck. Fire personnel assisted in removing Ricardo from the mangled wreck of the motor car. According to reports, he died on the spot. The crash in the meantime resulted in the temporary closure of the Bogwalk Gorge. JCF hosts first drone training course. The Jamaica Constabulary Force JCF says, as part of its continued push towards modernization, officers from the Clarendon Police Division have completed their first training course on unmanned aerial vehicle UAV, popularly called drones. The JCF said the course, which ran from May 11 to May 20, will upscale its members and boost the organization's responsive capabilities. The course is part of efforts to modernize the JCF. Minister of National Security Dr. Horace Chang in April had announced that his ministry has been investing in the resources required for modernization. We have invested in the physical working conditions of our police officers. We have invested extensively in modern technology, and we are modernizing the fleet, and we are putting in place appropriate maintenance programs to preserve our assets. I can assure you that as these measures come together, Jamaica will have a well-managed, efficiently operated police force that will be able to tackle crime and maintain public safety and good order, Chang said. Music producer Bobby Digital has died. Robert Bobby Digital Dixon, one of dancehall or reggae's most successful music producers, died on Thursday, May 21 at age 59. His son, Sheldon Calibud Stewart, said that he succumbed to a kidney-related illness. Originally from Olympic Gardens in Kingston, Dixon was a protege of engineer-producer Lloyd King Jammy James, with whom he started his career as an audio engineer. Dixon produced a number of hit songs by Shabba Ranks starting in the late 1980s with Peeny Peeny. Their formidable partnership also yielded massive hits such as Just Reality, Live Blanket, and Wicked in a Bed. Other hit songs produced by Dixon were Till I'm Laid to Rest by Buju Banton, Cocoa and Admiral Tibet's Serious Times, Garnet Silks, It's Growing, and Sizzler's Black Woman and a Child. He also produced Don't Have It Dread, the breakthrough song and album by Morgan Heritage. Robert Bobby Digital Dixon is survived by his wife Merva, 3 children, 2 grandchildren, a sister, and 2 brothers. Fear and anxiety grip maternity ward nurse. Fear, dread, and anxiety have become maternity ward nurse Samantha Brown's closest friends as she navigates working at the popular Cornwall Regional Hospital during COVID-19. Brown says that every day she fears for the safety of herself and her family because it's a new virus, a novel virus that they are still learning about. So every day we'll learn of new mutations of the virus. Like 3 days ago, we heard that it's now in semen. When it just started out, they said it couldn't travel through semen or vaginal fluids. And now we hear that it's through semen. So we have to be super careful. And another factor is that we don't have sufficient protective gear. We have to be conserving and just trying to make ends meet with what we have. Opening up in a no-holds-bar interview on Wednesday, Brown said that her fears were heightened recently by 2 pregnant women who left St. Catherine in the middle of the increase in the workplace cluster cases and the lockdown of the parish. They get through the loop during the lockdown. One of them, her excuse was that she came to stay with family. One said that she came to be closer to her boyfriend. And they were already here, so we couldn't turn them back. So we had to put them in our makeshift isolation room. According to her, the isolation room was not yet ready to accommodate patients. Looking back, Brown said that if the women had coronavirus, the porter and the security guard who transported them to the labor unit would have caught it, as well as the nurses. Neither of them stopped at triage, and the only protection we had on was the surgical mask. And when they came in, they did not have on any mask. And you know that COVID-19 is transmitted through the air and the droplets and those things. Brown noted that since then, pregnant women now have to stop at triage before going to the labor ward. Before leaving home in the mornings, Brown prays earnestly, asking God for protection. But even after she walks out the door, her feeling of unease and trepidation lingers throughout her day. Sometimes I try to not think about it, but you can't avoid it. It's there. It's what you deal with every day. Brown, like many of her colleagues, has stopped wearing her nurse's uniform because of the stigma attached to the job. At least 2 nurses have been doused with what was believed to be sanitizer while at a bus stop awaiting transportation. People are scorning nurses or anybody who they can identify as coming from the hospital, whether nurses, PCAs, or janitors who wear their uniforms, she said. Her colleagues are being called disease carriers. We are much cleaner than many who subject us to the abuse because we put on our gear. Before we leave work, we bathe and we change before we go on the streets. It's not like the word COVID is marked on people's foreheads. 6 years now on the job, Brown says that nurses in the profession who have been around for over 40 years say they have never experienced anything like this. Heartened by the donation of 2 buses to transport hospital staff recently, Brown said there has been improvement. She is, however, concerned about plans to reopen the country. There will be more cases because people are going to come into the island with the virus. So my fears will not go away anytime soon, she said. In the meantime, she wants counseling to be put in place for nurses. We as nurses have been talking that we need some serious counseling after this because we are mentally and emotionally exhausted. But we don't get counseling. I think we should because this thing is really affecting us. Brown has ceased watching the news because just seeing the numbers climbing in places like the US depresses her. As fearful as she is, the labor ward nurse says that she has never discriminated against anyone because she felt they might be carrying the virus. Her challenges are not unique to her, she says. My colleagues talk about theirs every day. JBN, we keep you informed. Please remember, subscribe, like, share. Leave us a comment and click the notification bell to receive our daily news items.